Hi, I'm Dr. Ron Delano. We're going to be discussing the structural cause of neck pain. This video is designed for physicians, researchers, and corporate interests that might deal with technologies that help with neck pain. The name of the structural condition we're going to talk about today is forward head posture. Now, if you look at the x-ray here to my left, you'll notice that the head is forward of the shoulder region. One of the things we'd like to see is the head back over the shoulder region, just like you'd see in this angle. And if you look at the vertebrae here, in addition to the head being forward, they're kind of straightened. So the characteristics that we see with forward head posture is the head moving forward and the straightening of the neck curve itself. In the video to our left, the picture here, you'll see that the normal curve line is in yellow and the vertebrae are arcing close to that forward curve line. You'll notice that the posterior cranial area is pretty much lined up over the shoulder region. So this would be ideal posture and in a healthy alignment. Going back to our original picture, the head is projected forward, and as a result of that, the neck is straightened. And when you look at the normal curve line where the cursor is, you'll notice there's a gap between the vertebra and the forward curve line. In fact, those gaps are measured at 8.20 millimeters. Again, back to the more normal film, you'll see there's very little space between the vertebra and the normal forward curve line. In this picture here as well, we're going to be looking at some of the long-term effects of forward head posture. If this were to be there for a long period of time, it would start to cause wear and tear on the joints where the cursor is. So the global view shows you mid-cervical spine. The magnifying viewer shows you the degeneration to the joint where the pointer is. Now, a normal joint higher up would have a larger height, and there'd be a clear space between the bodies of the vertebra. When you go down to a little bit further in the spine where the damage is, you'll note that not only is the height diminished, but the space separating the two vertebral bodies is very diminished. There's arthritic changes going on around the joint, and there's disc pathology in this particular case as well. Now, some of the causes of forward head posture in the past have been falls, traumas, sports injuries, any kind of trauma that could occur to the head and neck region from a variety of causes. But over the last 20 years, with the advent of the computer and the electronic media and the viewing of smartphones, iPads, and other electronic devices, the forward head posture position has been exacerbated because of the working conditions that the person's putting their head into. An example would be, if we look at the video, the x-ray to the right, if you're looking down where the arrow is pointing, your head looking at either a computer monitor or an iPhone or a tablet will cause your head to project forward. And if you're doing this for many hours at a time, this chronic posture contributes to the degeneration of the joint over time. And this results in neck pain, headaches, arm and shoulder pain, and a number of other conditions related to this chronic posture. The correction for this thing is to improve posture, and one of the things we're going to discuss today, or the most important thing, is the new cervical orthotic collar, which is designed to correct forward head posture and to resume the normal curve in the cervical spine. Hi, this is our patient Jessica, and she has a forward head posture condition that we talked about. Notice that her ear is in front of her shoulders, her head is slightly downward. This is very common of people who are viewing smartphones or iPads, any electronic media that would cause the head and the visual gaze to go down toward the monitor. Now, what we want to do is correct this forward head posture into a more aligned position. So let's go back where you were, Jess. All right, and this is the device, the Cervigard orthotic collar, which is designed to correct the head posture and at the same time help build the neck curve. The features of the collar are the correction process of the tracks, which allow to go rearward, pushing the head rearward. These cheek pads hold the head back into position. The opening gate allows the patient to dome the collar on, and then once we put that in place, there are vertical adjustments to match to the cheek height of the patient who is using it. Not all faces are the same size, so we have vertical adjustments for the cheek pads. We have the collar arc that dawns on from the rear, and then we have the track mechanisms which allow us to bring the head back over the shoulders. In the rear of the collar are the fulcrum pieces we talked about, which are designed to encourage the forward lordosis of the cervical spine. So with that, let's put this on Jessica. Now I've pre-measured it for her to save us time. This goes over the shoulders like so. And then when we come around from the front, the cheek pads will then come over. There's a latch mechanism to hold it in place. And then the patient is asked to retract their head while we turn the collar rearward. So Jessica, why don't you take over? You know how to do that. Turn them rearward. Keep going. Keep going. Jessica is young and she has a lot more flexibility than someone in their 50s or 60s. But you'll note that the track went back almost all the way. Notice Jessica's side posture. Her ears are over the shoulder. And now with this position in the fulcrum, which I preset for her in place, she'd only have to wear this 20 minutes a day. And after approximately 6 weeks, her neck curve would come back, maybe completely, and her head position would be now in a corrected posture. We of course also educate the patient about proper visual position when you're at their workstation and holding a monitor up higher, whether it be the iPhone or the iPad or whatever smartphone device they're using. All right, so Jessica, why don't you reduce that now, take it off a little bit. Let's pretend for a second that Jessica is an older patient. Let's stop right there, Jessica. That might be the distance that you want to go with an older folks. So we start at a position that's comfortable for the patient, then we push a little bit further back. They may wear it like that for several days, and then we can increase it gradually over time if the patient had arthritis or any disc issues in the cervical spine. But most of the folks that are under 40 can get back there pretty quick, all the way to the full extension position. So we have adjustments forward and aft, we have adjustments vertically, we have the fulcrum in the back. And she could use this while she's watching television. She could work at her computer station. She could be even do some mild exercise on a sitting machine. The nice thing about this particular device is that you can multitask. You can do other things while you're doing this. If you're a doctor at the end of the day, you're making your notes, that 20 minutes, hour that you're spending doing that, you can put the collar on and do that and make sure you're in good head posture while you're working at your computer station, and at the same time giving your neck a treatment to allow for proper hygiene and healing from the long day's activity. So the uses of this thing are varied. Prior devices used, I know, in chiropractic offices will require the patient to lie on a table with a roll behind the neck or sitting in a traction machine where they could do nothing else but that for the 20 minutes, and then they'd have to go to the office 3 or 4 times a week to duplicate that service. Oftentimes that's too expensive. Oftentimes the compliance issues are there, that they won't do that. So having something at the ready that you can use daily at your convenience on your time schedule and you can multitask, I think is a great advantage for patients in the future. Jessica is now going to demonstrate how easy it is to remove the device. It's very easy to put on and take off. Jessica, take the track down to release the pressure. And once you feel it released, you're good to go. You're good there right there. Now just, that's it. Pull the front part off. And it's pretty simple to use it.
This is Jason. Jason entered our office with severe neck pain. He was in acute torticollis, sharp pain lower part of the neck, couldn't turn his head. We did a series of adjustments to get him out of that acute pain, and then we started treatment with the collar, 15-minute intervals 3 times a week. This has been going on for about a month now. Jason, tell me what you've experienced with using the collar.
After the first couple of treatments of getting the immediate pain to go away, the collar then taught me proper posture. I've been told that was my head was too far forward, but I can never quite get the feeling for where it should be. But the collar sort of just trains the body to know where the head should be positioned over the shoulder and neck. So throughout my day, I was sort of just reminded of where this collar places my head. I sort of catch myself leaning forward, and knowing where the collar puts my head, I can easily just kind of adjust my head back to that proper position. So certainly it trains the body to know exactly where the head should be to relieve that sort of too far forward head.
This is Justine, 28-year-old female, came into our office with headaches, neck pain, lower back pain, and nausea while laying down. We've done 3 treatments, 15-minute intervals with the collar. This is the 4th treatment today. But since we started the collar, Justine, could you tell us what you've experienced?
I have no more headaches and no more nausea. I can stand up and sit down and not get nauseous or sick, and I can do the neck roll at home now, and it's just made all the difference, really.
Our patient, Danny, he was on an auto accident on June the 11th, was treated for the first week and a half. He had pain in his neck, radiating down his left arm into his hand. A lot of discomfort, was unable to sleep because of the pain. We started him on the Cervigard neck orthotic on Wednesday, 2 days ago. He had 1 treatment. Danny, tell us how you felt after that the first week or so. You still had quite a bit of pain. There was very little relief with just the chiropractic care. Once we used the collar 2 days ago, what happened?
Almost immediately once the collar came off, I felt a lot of the pressure on my neck was gone. The pins and needles and numbing pain that I was feeling in my arm is mostly erased at this point. I felt so much better since the first use of the neck collar.
And we had an MRI done the first week right away, and we found 3 herniated discs in the cervical spine, along with the associated forward head posture and straightening of the cervical curve. This has made a dramatic improvement after just 1 use of the collar. Would you turn sideways, Danny, so we can see the head placement? Notice how the ear is well positioned over the shoulder, so the weight of the head is now properly supported by the spinal column. We're going to continue doing this on Danny 3 times a week for the next 6 weeks. Then we're going to take a post-cervical x-ray, a lateral, and we're going to compare it to the original to show the collective permanent change.